I want to say we were honored this morning to welcome the President of the United States to our House Republican Conference. I want to thank him for taking the time to come here to the Hill to talk to our members and for his steadfast leadership throughout this entire process. President Trump was here to do what he does best, and that is to close the deal. He is all in, and we are all in to end this Obamacare nightmare. I think what this comes down to is what it said on those banners last night at his rally in Kentucky. Promises made, promises kept. Obamacare was anything but that. People were promised one thing and they were given another. They were promised that they'd get lower premiums. Instead, premiums are skyrocketing and people are paying so much more. They were promised that they could keep their plan, and many millions have lost their plan. They were promised more choices. And now, millions of Americans have no health care choice at all. 7 years of this failed experiment is enough. This is our chance to build a better, a fairer, and a better health care system for all Americans. All of us, the President, the House, and the Senate, we made a promise. We made a promise that we would repeal and replace this disastrous law, and we are going to keep our word.
Well, good morning. We're just coming out of a conference with the President, enthusiastic. I thought he made a very passionate discussion of why to keep your word. I thought he laid out a very clear, concise agenda of what he's actually been doing of keeping his word. And as I announced last week, the House will vote on the American Health Care Act this week to repeal and replace Obamacare. But as you know, reconciliation does not allow us to put everything we need into the bill. So we're actually starting on separate legislation. As we said, this is 3 phases. We'll start with phase 3 beginning. We'll first have the Competitive Health Insurance Act. As you know, Obamacare has destroyed the marketplace. 1/3 of all the counties in this country only have one choice. That also creates a monopoly. Some counties have no insurance, and the government wants to penalize you because you can't even buy it. Obamacare created 23 co-ops, gave them more than $2 billion. 18 of those have already collapsed. So the goal is to provide federal antitrust scrutiny to an industry that is becoming increasingly concentrated. Second, we'll provide Small Business Health Fairness Act. We talk so much about letting small businesses pull together, but we also talk about across state lines. This allows small businesses to pull together and go across state lines. I opened my first business when I was 19 years old. There's 3 lessons you always learn. You're the first to work, the last to leave, and the last to be paid. But you know those who work for you are like family. You want to be able to provide the health care for them. But you're at a disadvantage between the big companies and the small ones. Why don't we let the small businesses that help drive this nation pool together to have the strength of big business as well? Because Obamacare regulation has actually made it worse. And so much of when we talk about when we repeal Obamacare, yes, it's about health care. But what about the 30-hour work week? What about the 50 employees or less that has decimated small business? 95% of small businesses reported increased health insurance over the last 5 years. 10,000 small businesses have closed down, costing 300,000 jobs across under Obamacare. Now, this is just part of phase 3 that we're moving right now. But Thursday will be a big day. Thursday will be the day that we keep our word, that we will repeal and replace and continue on with phase 2 and phase 3.
It was great to welcome President Trump to our conference this morning. And for weeks now, President Trump has gotten directly engaged in negotiating with our members. And he reached out and he said, bring me your best ideas. And you saw every element of our conference come together and bring those ideas. Everybody from Republican Study Committee members to Tuesday Group members to Freedom Caucus members who came forward, and President Trump brought those ideas together. And we agreed in the package that we put together last night to add all of those elements to the bill, elements that make it even better for families. Because at the heart of this is the acknowledgement from President Trump to all of us that Obamacare has failed the American people. And I think it's important to get back to the reason that we're doing this is because we are leading a rescue mission to finally let families be in charge of their health care decisions again. CBO confirms that, literally saying 14 million people will choose to get off of Obamacare if we give them that freedom. I think that's a novel idea. Freedom for families to make their own choices in health care. That's in our bill. Over $900 billion in tax cuts, direct relief and money back in the pockets of working families is in this bill. You know, National Right to Life is scoring a yes because it's probably the most pro-life bill that will get to a president's desk for their signature since partial birth abortion. Revolutionary. Something else that's revolutionary is giving the states the ability to run their Medicaid program without having to come beg Washington bureaucrats for permission to do innovative things that help improve the health care of families in their states. All of these reforms and more are in this bill that's coming up for a vote on Thursday. And it's really great to see not only that the president is all in, but that the president has made it clear that this is the first step in us finally getting our country back on track and following through on those promises that have been made for years, that we would not only rescue people from Obamacare, but then it sets the stage for all the other big things that we want to do to cut taxes, to get our economy back on track, to get regulations out of the way, and make Washington work for families again. So again, it was great to see the president here and express to our members that he is all in and he wants this bill on his desk for signature, and the only thing that's necessary is for every Republican to vote yes.
President Trump is a man of action, and the people have demanded action of us. We promised that we would repeal and replace Obamacare, and that's what we're doing this week. Our first step, the American Health Care Act, has gone through 3 committees. It will go through the 4th this week and then be brought to the floor for a vote. And I encourage you to go to passabill.gop to get more information. This process has been open, it's been collaborative, we've engaged the people and we've engaged each other, and we've listened, and this bill reflects those conversations. President Trump has been a key partner every step of the way, and he reaffirmed that commitment to us this morning. We're ready, and we are eager to get this bill to the Senate. As we cross the finish line on phase 1, we're also going to work on additional phases. Phase 3, the legislation that will help reduce cost and increase more choices. The legislation to remove the antitrust provisions for insurance companies, to give small businesses the opportunity to join together in association health plans. This is about freedom. These are conservative, patient-centered reforms that are going to increase choices, and we know that they will make healthcare more affordable and more accessible. 7 years ago, this very week, Obamacare was signed into law. And since then, we've seen premiums go up, deductibles go up. The only thing that hasn't gone up is patient satisfaction. Whether you're a family of 4, single, young, old, one of the most vulnerable in our community, under our plan, you'll be able to pick the best health insurance plan to meet your needs, not a plan that the government thinks you should have. Doing nothing is not an option. Obamacare is collapsing, and we're on a rescue mission. We're on a mission to create a better healthcare future for every person in this country.
7 years ago, I made up my mind to retake my seat to come back because of what had taken place 7 years ago this week. And as I've talked with people even as recently as yesterday in a town hall meeting, and I talk about our comprehensive plan that includes a 3rd phase that goes to the heart of getting back control to individuals, I'm so delighted that a bill that Sam Johnson and I have worked on for years that gives the opportunity for association health plans to allow small businesses and their employees to experience the same benefits that I'm proud to say come to my union workers, my auto manufacturers, because of an economy of scale, to have a plan that works for them. This association health plan will be an amazing asset as we move forward in completing what it takes to go from a plan that has destroyed healthcare in this country to a plan that gives options and approaches that small business that employ 85% of all my workforce in my district, the opportunity to have an affordable plan that meets their needs, that gives them choices, and helps them to succeed. So it's an exciting time for me as we talk about this first step, this first phase. But the 3rd phase, we're already able to say these are the types of things that we promised and we're going to carry out and give opportunity to our people.
Questions? Jonathan.
Given the revelation yesterday by Director Comey about investigating possible collusion with the Russians How certain are you that the Steele dossier is false?
Which one are you talking about? Is that the opposition research one? Yeah, that's what he's talking about? Okay. Look, I don't think we learned anything new yesterday with Comey's testimony. We have an investigation that's been going on in the Intelligence Committee. There's one federally. We're going to get to the bottom of things, all things Russia. But it is very clear that we have seen no evidence and been presented with no evidence that Donald Trump or his staff were involved in this with the Russians. Who are you?
The President told your members that he believed many would lose their seats if this doesn't pass. The majority is at risk. Do you agree with that assessment?
Yeah.
And do you believe that you guys have done enough to assuage their concerns?
Absolutely. The President of the United States came to us and said, we all made a promise to the American people, and we need to keep our promises. Everybody running for Congress in the House, everybody running for Senate, the President himself said to the American people, you give us this chance, this responsibility, this opportunity, with a Republican President, with a Republican Senate, and a Republican House, and we will repeal and replace Obamacare. We are using the tools that we have to do that. That's this budget reconciliation. You can't put everything you want into that bill. That's why we have a three-phase process that we're very confident works. But the President was really clear. He laid it on the lines for everybody. We made a promise. Now is our time to keep that promise. And we keep our promise, and the people will reward us. If we don't keep our promise, it will be very hard to manage this.
Last question.
Yeah. Were you doing the thing to your hair, or were you raising your hand? I couldn't tell. I thought you put your hand up. I just looked in the middle, and I saw your hand. Did,
Saying that they still don't have the votes to pass this by Thursday. What's kind of your game plan?
Yeah, I disagree with that because we have a lot of Freedom Caucus members who are supporting this bill. We've been working with all of our members on many of their concerns. And I would simply say that a lot of the members' concerns have been incorporated in this process. And so if you take a look at what we've been able to add to this bill, the things that are huge conservative wins, giving states the ability to take a total block grant for Medicaid, giving states the incentive to have work requirements, preventing non-expansion states from expanding and gaming the system. This is the most pro-life legislation we've had since partial birth abortion. It's a massive tax cut, and we made the tax cuts effective in 2017. All of those things were requests by these members. And so in this day and age, and in this business, in politics, if you get 85% of what you want, that's pretty darn good. We know we can't get 100% of what we want every time around here in this particular case because of the Senate rules. We don't want to put something in this bill that the Senate is telling us is fatal to the bill being brought up in the Senate. So that's why we're going to pass the best possible legislation we can. We got it there. The President helped negotiate these changes, send it over to the Senate, and then the Senate, without jeopardizing the bill, can make improvements to the bill. But if we do it here, we will jeopardize the entire bill. So I think people respect and understand this legislative process. I think members, once they realize this in the final analysis, that we're getting the vast majority of the things that we think should be in this bill. And then at the end of the day, it really is a choice. Do you want to stick with the Obamacare status quo? Do you want to stick with the idea that we made a promise and we're not going to keep it? Or do we want to replace this bill with clearly a much, much better law, something that makes good on our principles and our promises and gets this country on the right track? I think people in the final analysis will make that decision, and I feel very good. And I think the President, I got to just say, editorial, the President just came here and knocked the ball out of the park. He knocked the cover off the ball in explaining to our members how it's important to unify, how it's important to work together, how we are advancing our principles, and we are doing what we told the American people we would do. This is our chance, and this is our moment. It's a big moment, and I think our members are beginning to appreciate just what kind of a rendezvous with destiny we have right here. Thank you.